This meeting of the Texas Opioid Abatement Fund Council will come to order at 10:01 a.m. Thursday, March 22nd, 2026, pursuant to the notice of public meeting, which was filed with and posted by the Office of the Secretary of State on Tuesday, March 3rd, 2026. The council will consider only those matters that have been posted. The meeting materials now available on our website, and we can also provide them via email after the meeting. Members, you must have your camera on and audio working when you're speaking. You may use the raise hand function if you'd like to be called on. Votes will be taken with a voice vote today.
Got something.
Each of you is integral to this process, so please keep your camera on and be ready to unmute yourself when it comes time to vote. If we lose our WebEx connection for some reason and are unable to restore it, we will end the meeting and notify the members via email. I will now ask Katie Fallon Brown, Director of the OAFC, to call the roll.
Associate Deputy Controller Rob Pullman. Dr. Demore. Dr. Demore. We'll come back to you. Dr. Demore?
Did you say Guevara or Demore?
Not yet. Well, we'll say Guevara next.
Okay.
I'll go out of order. Dr. Kivala?
Yes.
Perfect. Dr. Mills? Can you unmute there? Dr. Milton?
Present.
Dr. Thornton?
Here.
Dr. Wilkes?
Here.
Ms. Yoder?
Here.
I'm gonna go upside down. Dr. Mills? You can unmute yourself, Dr. Mills. We'll call you again in a second. Dr. Fernandez?
Present.
Dr. Feno?
Present.
Detective Enriquez?
Can you hear me?
Yes, sir. Okay, we'll mark Dr. Mills as present. Detective Enriquez?
Present.
Dr. Eloise?
Present.
And Dr. Demore?
Present.
Perfect. Awesome. Everybody's here.
Yeah. Can you hear me now?
Yeah, there's 13 minutes here.
Yes.
Okay.
Yeah, 13.
All right, thank you. There being 13 council members present, a quorum is established. Members, thank you for your attendance at today's meeting. I want to recognize that Acting Comptroller Hancock has joined us for today's meeting. However, I am designated to be the presiding officer for today. So with that, let's take care of the minutes now. All right, so moving on to agenda item 2, we will now consider adoption of the minutes of the December 9, 2025 council meeting. Members, you have received a copy of the minutes before today's meeting, and they are on page 7 of your council book. Do I have a motion to approve the minutes of the December 9, 2025 council meeting?
So moved.
Was that Dr. Mills? Yes.
All right, I have a motion by Dr. Mills. Is there a second?
Second.
I have a second by Dr. Fernandez. Members, please unmute yourselves, and we will do this by a voice vote. All those in favor, say aye.
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 All those opposed, say no. Those abstaining? There being 12 aye votes, 0 no votes, and 0 members abstaining, the motion passes. Thank you, members. I'm going to ask Katie to open discussion on the next agenda item, awarding the recovery housing expansion grant.
I'm actually going to move on to the rules. So on page 11, you'll see the rule revisions that you approved at the September meeting for publication in the Texas Register. No comments were received from the public after the rules were published, and we now need another vote for final adoption. Most of the revisions are to align the rules with actual practice and to simplify the council's operations. One example is one rule revision allows staff to authorize certain amendments to grant agreements without bringing every single request to the full council. Are there any questions?
All right. Thank you. Is there a motion to adopt the proposed rule amendments?
Motion.
Second.
Is there a sorry.
Got a motion from you.
Okay, thank you. There's a motion from Ms. Yoder. Thank you. Is there a second?
Second.
I have a second from Dr. Mills. Members, at this time, please turn on your cameras and unmute yourselves for a voice vote. All those in favor, say aye.
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 All those opposed, say no. Those abstaining? There being 12 ayes, 0 noes, and 0 members abstaining, the motion passes. Thank you.
Thank you. The rules will be submitted to the Texas Register and they'll be effective 20 days after submission. If it pleases the chair, I'll move on to the 2026 grant issuance plan. As you remember, in December, the council adopted a 2026 grant issuance plan with 2 grant cycles for this year, $25 million in the spring, targeted to the criminal justice system, and $75 million in the fall for regional core grants, which would prioritize MOUD and pregnant and postpartum women. At the time, the council directed staff to do more research into the criminal justice topic in order to better narrow the scope and parameters of the grant opportunity. Since then, staff, particularly Lauren and I, met with several subject matter experts in correctional managed health care, 2 different divisions of the Department of Criminal Justice, the teams providing medical care at both a large county hospital and at a large adult community supervision department. We toured facilities, and very cool, we got the Commission on Jail Standards to put out a survey for us of all the jails to assess how and if they're providing OUD treatment. We pulled together a few of the council members that have specific interest and expertise in this field. We shared what we learned, and with their input, we're proposing the language that you see on the last page of the board book to refine the scope of the grant opportunity. In short, as written, the proposal is to open the grant opportunity to all types of applicants without any parameters on the geographical scope, and to limit the requested amounts to a minimum of $250,000 and a maximum of $2.5 million. Would anyone like to add anything? I'll look for hands raised. Oh, Dr. Fenham?
Yeah, I can just add a little bit about the discussion that was had around the specific numbers. So the floor of 250,000 and the ceiling of 2.5 million. This was felt by the working group, sub-working group, to check a couple of boxes that we thought would be pragmatic. So one was ensuring that even at the maximum, there would be a sufficient number of potential independent projects to span a large geographic region, and a floor that would ensure that the impact of the project would be substantial, but that also would be more tractable for either rural locations or smaller applicants. And then also considering that it's a 2 to 5 year flexible timeline for the grants, thinking about how that's divided into both the floor and the ceiling. And so thinking about, essentially the maximum would come out to be about $1.25 million per year for a 2-year, $2.5 million grant, and a floor of $50,000 per year for a $250K 5-year grant. So those are a little bit of the backstory for folks who weren't part of those discussions. And then my colleagues are welcome to add to that, of course.
Dr. Thornton?
Hello, good morning. Just one point of clarification and then a question. So the 250K and 2.5 are total funding, so over the entire 5 years, or those are annual funding limits?
Those are the entire request.
Okay. The second thing is, so for those of us not on that committee, and I don't know if we have anybody from the public joining us, but could you talk a little bit about what some of the findings were from the conversations with the stakeholders? Like what their interests were in like engaging with the OAFC for funding initiatives?
Does
For
anyone?
this call specifically, not in general, but yeah.
Sorry, say that last part again.
For this call, the criminal justice call specifically, not in general, so.
Before I jump in, I'll defer to the council members if there's any particular insights that we shared that you learned. Dr. Kubala?
Yeah, my only question with this is, isn't this already budgeted into the criminal healthcare system for these medications? Is this going to be replacing this in the state budget, or is this going to be in addition to? How is this going to augment what we already are currently doing?
I'm happy to make some comments to kind of respond to that. I think kind of speaking with some of the individuals kind of doing the work, I mean, there's not a lot of current funding for some of these initiatives. And we're talking about, for example, some of the medications, some of the interventions that some of the organizations are proposing are looking at, for example, injectable buprenorphine that tends to be very expensive, but there is a lot of benefits of utilizing that in comparison to traditional buprenorphine for opioid use disorder. And then there's a lot of organizations or institutions, facilities that don't have access to medicated assisted treatment, or have a lot of support with jail release after individuals are released from their facility. So I think there, and I'll defer to kind of other individuals who've been kind of involved in this work. There's a lack, to be honest, there's a lot of services across the state, and it could be utilized in a lot of different ways. I think it's going to also depend on the location in the facility. So that's why we wanted to keep it very broad, because maybe some organizations have or facility has a very good medicated assisted treatment program within their jail or within their facility, but other organizations might not. Some organizations might already have a jail release team, other organizations might not. So I do think I think there has been kind of a consensus that a lot of these facilities don't have sufficient funding to address this and address this well. So we wanted to, again, keep it as flexible as possible to allow different groups to kind of approach us with potential funding. And that's why we try to just maximize the flexibility, because I think if you look across the state, we're going to see a lot of different groups that might not necessarily have the same needs, but still could utilize the funds in this effort.
So my question is it only to augment, or can they use it to replace funding? That's my question.
I can comment.
They already have a program, and now they're going to use it to fund that program. My concern is once this grant runs out, now that program goes away, so they're worse off than they were when we started. So if it's only to augment programs, then I think that's I'm in favor of this. But if it's going to replace an already existing program and the funding for it, then I'm concerned that at the end of this program, that funding may go away and the program may go away.
Well, I think you'd
I
have to look
think,
at the individual grants. I mean, that's, when you have kind of a broad scope of grants, when they send their grant proposal in, we can ask them specifically, is this going to replace any funding? And if it is, then we can uh, downgrade that grant proposal, you know. So if we want to put an emphasis on augmenting, the problem with MAT is, of course, it's mandated under the Americans with Disability Act, but that doesn't mean everybody's in compliance with it, statewide. But the real problem is transitioning into the community and continuing MAT and counseling and follow up and all that. So I would see most of these grants either initiating programs where they don't exist or using this to build, bridge programs into the community so we can try to keep some of these people out of jail.
And I think I'm in favor of this too, because I think this needs to have some outcome measures that exactly what you just said. Is this keeping people out of jail? Because if we're just going to, a lot of these programs are supposed to exist anyways, is my understanding. And I can see that they don't. And you guys have very eloquently said that. But again, I'm concerned about sustainability too, is that all of a sudden you have people that we now establish a program that was supposed to be done anyways. Now the funding runs out and the program just goes away. So anyways, that's just my 2 cents. I'll be quiet from here on out.
I'll add in, go ahead, Dr. Thornton.
Well, I don't disagree with anything that's been said necessarily. I think we have kind of a plan and expectations of what these could be. My question, just to loop back to the original, was were we as kind of a group, I mean, you all as staff are the ones who did it, but able to hear from the stakeholders who would actually be applying that they are interested in doing these things? Like that's the big question in my mind, right? Is, are there organizations that say, yes, we want to do A, B, C, and D? And now that we're voting on this, are A, B, C, and D at least listed in the new wording, right? I just want to make sure if we're voting to change the wording, we are being responsive to what the community needs and is requesting.
I will say we had lots of meetings. None of these stakeholders were that explicit. No one said, this is what I want your NOFA to look like. And frankly, that's probably for the best. There was a lot of interest in getting more resources into helping people in the criminal justice system, keeping people out of the criminal justice system, and helping people transition out of the system. There was a lot of emphasis on the case management. I think there's just a lot of difficulty, as Dr. Fernandez alluded to, when people get out of jail, making sure that they know their resources out there. And as far as Dr. Kivola's point, one of the criteria that we put in the NOFA that we ask the peer reviewers to score on is sustainability. And that is something, when y'all make your awards on this project in several months, that's completely up to you. If you think a project isn't sustainable, we also emphasize that these funds are to augment and supplement and not to replace or supplant. And that is, that's always been the intent. These funds are going to be around for a long time, but not forever. And I think we have some very cool opportunities here. So, anyone else have anything to add about this project?
yeah, I'd just like to say that I like the idea that it is broad so that we can see and we can kind of highlight some programs that exist. I think we were all kind of shocked in the meetings to find that so many programs in TDCJ just don't exist at all. And if we can bolster and enhance the programs, especially on these handoffs or on their recovery once they are released, that's the ultimate goal, is to get these programs going to kind of further the success when they're outside.
This is Dr. Mills. I think to answer one of the points, I think by keeping it broad and by having outcome measures, I think maybe we can garner some convincing evidence. So to the legislature that, hey, if we can keep, a certain percentage of people out of jail, that's saving you money. It's expensive to keep people in prison and jail. So I think if we can garner some objective evidence with some outcome measures, I think in the long run, that's going to help the legislature develop some sustainable funding.
And outcome measures will be in the NOFO. So my understanding, right, we can include that and solidify that and the details of it later when the NOFO actually gets posted.
Dr. Louise?
Good. Thank you, Kari, and thank you for the discussions. And I think you provided the information that we wanted the last time we met in terms of people really interested in doing this work. All of us in this field know that that's an area that will have great deficiency, and that's an area with very serious morbidity and mortality. For it, we all know that if you leave the jail, the chances of dying from overdose is 100 times. So that it's an area that we really have to focus on. If the grant itself is a catalyst for this to happen, I think that's something that we certainly want to be interested to pursue. And certainly, we all understand that sustainability is important. Measuring outcomes are important, but this is an area that I'm really happy that we want to focus on. And I like the broad-based criteria that the subcommittee has come up with. And I think it's important for us to start and see how much we can begin to change substance use disorder care, particularly in the criminal justice system. There's certainly a great problem there. It's imperative that we try to do something about it.
Dr. Keeble, your hand is still raised. Oh, Catherine. Oh, do you have something to add, Catherine?
No, I think you spoke to it. I was going to speak to what Dr. Thornton was talking about in terms of, are people interested? I think your survey said stuff, and I think that, I'm really glad that you and your staff did kind of that research to make sure we were putting it in a place that is needed. I can speak for Dallas, but I can't speak for, of course, across the state. And I think the work that your team did was great.
Thank you. It's really, really interesting. And it'll help us write a good NOFA. Anyone else have anything to add?
All right, thank you, members, for the discussion. Appreciate that. Do I have a motion to approve this amendment to the 2026 grant issuance plan for the targeted grant strategy for opioid abatement within the criminal justice system?
So moved.
Second.
Okay, there's a motion from Dr. Thornton to the amendments to the 2026 grant issuance plan. Is there a second? There's a second from
Second.
Dr. Mills. Thank you. Members, at this time, please turn on your cameras and unmute yourselves for a voice vote. All those in favor say aye.
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 All those opposed say no. Those abstaining? There being 12 ayes, 0 noes, and 0 members abstaining, the motion to amend the 2026 grant issuance plan for the targeted grant strategy for opioid abatement within the criminal justice system passes.
Okay, we will get started. We will update the grant issuance plan online and start working on the NOFA. I'll jump ahead to just a couple of quick updates from what the team's been up to, in addition to what you've already heard. We now have 80 short-term core grant agreements completely signed. We're enjoying getting the grantees set up. We're processing their requests for reimbursement, and we're doing site visits. 2 particular site visits I want to mention. The acting controller, Hancock, he joined us in Magnolia to visit a site in January. And Dr. Louise dropped by an event in Longview For our naloxone grantee, University Health had a booth. Do either of you want to say anything about your visits?
Well, I think it was a great pleasure for me to drop by and support them. It was very, very well attended. I mean, I was surprised the whole hall was full, and saw some of my old colleagues to add to it. So yeah, so I think it was very, very successful. And the acting controller, I came to Tyler sometime too, and we had some discussion. So thank you, controller, for coming to Tyler. We really enjoyed your visit.
Yeah, I enjoyed the visit quite a bit. I think it's important to get out and not just, issue these grants out without seeing what's going on, just so you can have that experience. And it was a worthwhile visit.
We were happy to have you. Thanks. The long-term core application deadline was last week. We had 226 applications. That's more than we did for the short-term core grants. We had at least 3 applicants per region. The team is working really hard on doing administrative review as we speak, and then we'll send those to Texas State for peer review. Ideally, we'll have a council meeting in late May or June to make the long-term core awards. We are also working very hard to automate the process by which we write those grant agreements so that hopefully we can get a lot of efficiency there. At the end of February, we submitted our annual report to NOACT describing how certain settlement dollars were spent in calendar year 2025. We'll share that with the numbers group. That was actually a lot of work. We surveyed all the political subdivisions and hospital districts so we could provide accurate information to this one settlement group. And then as we speak, our friends at the trust company are sending $1.5 million to the political subdivisions for their 2026 distribution. 11.5 million, excuse me. Thanks, Lydia. Those are the big updates from staff. We have also hired 2 new grant specialists. Ashley Ramirez and Lauren Yerke have joined the team, and they are hitting the ground running and doing a lot of administrative reviews right now. We're very happy to have them. I'll go into more detail or turn it back over to Rob. Any questions?
All right, thank you, members. So we're at the end of our agenda. Do we have a motion to adjourn?
So moved.
Second.
All right, so I have a motion from
Thornton.
Dr. Thornton and a second from
Dr. Mills.
Dr. Mills. Thank you. Members, at this time, please make sure your cameras are turned on and unmute yourselves for a voice vote. All those in favor say aye.
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 All those opposed say no. Those abstaining, there being 12 ayes, 0 noes, and 0 members abstaining, the motion passes. Thank you for your attendance at today's meeting. This meeting of the Texas Opioid Abatement Council is adjourned at 10:29 a.m. Thank you.